on this very complicated medical logistical exercise. So, the vaccine has arrived. What's the next step?
Well, Jeremy, what we know so far is that that vaccine has now been taken to a storage facility here in Johannesburg. This is where it will be subjected to several technical processes. And, of course, these include the counting of those doses to ensure that the right amount of doses have arrived in the country. But also, it will be checked if there are any breakages in that consignment that we saw arriving yesterday at OR Tambo International Airport. But following that, the President alluding to the fact that they will then be taken to the National Control Laboratory. That's where some of the samples will be tested in terms of the integrity of that vaccine, whether or not the quality has not been compromised by the traveling process that it had undergone. And also to be checked whether there is no contamination in terms of those vaccines that have been received and whether they are safe to be then used for the inoculation that's planned for healthcare workers, of course, who are earmarked as being the front line in terms of receiving this particular jab. So in terms of that plan, the unions are quite hopeful, Jeremy, that the vaccination rollout will take place from the 10th of February. In fact, we spoke to Nehao earlier on. They're saying that according to the plan that they've seen and that they've been engaging with government, they're expecting the healthcare workers to receive their first jab as early as the 10th of February. Take a listen to what they had to say.
The timeline that had been agreed to, that we supported, indicates so. So that's why it's also upon our responsibility as a trade unions, without necessarily relying on government alone, to put pressure as from today to make sure that by the 10th of February, this thing is delivered. So we're working tirelessly to ensure that that thing happens. And as things stands, from our reading, we don't see anything that might arise as that might lead to a delay.
You've also spoken to the big nurses union.
Indeed, Jeremy, and of course the union is quite hopeful that this vaccine will be able to be delivered on time. You did hear the President allude to the fact that there has been over 200 centers that have been identified across the country that will actually be responsible for this inoculation process. And the union is saying that they have been in talks with some of the provinces, the MECs from the various provinces, as well as the HODs from these provinces on that rollout plan. And they are quite hopeful that there won't be any delays in this particular process. But of course, they are quite concerned on the issue of staffing with regards to the staff shortages and how this particular vaccine will then be delivered due to these issues. But take a listen to what DINOSA had to say in terms of their concerns.
We are very concerned because this vaccination program is an additional work to our healthcare workers. And as we know it, our healthcare workers, as we speak, their hands are full. They are busy in our facilities, just as they were busy even before COVID-19. They are busy now, and here comes this additional work that needs them to vaccinate 14 million population. With which hands? That is our question. So we feel that government must look into the issue of augmenting numbers, staff numbers, to ensure that this program is implemented timeously, because we foresee danger of delays if additional personnel is not added into the program.